Hello, welcome. Our topic is HIV and other sexually transmitted infections. HIV and other sexually transmitted infections. HIV stands for Human Immunodeficiency Virus. This virus is the one that breaks the immune system and causes AIDS. Human Immunodeficiency Virus. Why AIDS stands for Acquired Immunodeficiency Syndrome. Acquired Immunodeficiency Syndrome. So HIV causes AIDS. So when a person has HIV, they are said to be HIV positive. You can see the test results on your screen. That is for someone who have tested HIV positive. They use the blood sample to do it. Drugs for treating HIV and AIDS. It's known as antiretroviral drugs. We call them ARVs. Antiretroviral drugs. They are used in the treatment of HIV and AIDS patients. Most times, government supports them because they are very expensive. Ways HIV can be spread: having unprotected sex with someone who is infected. HIV can be given to someone who is not infected through that means. Okay, the next is transmission from mother to child. When a woman is pregnant, okay, HIV can be transmitted from the mother to child, but it's not always the case now because it can be prevented. There are drugs. Another way of spreading it is using needles or syringes that have been used by people who are infected. So pre-chewing food for infants, people who are infected can give it to persons who are healthy. So, but ways HIV cannot be spread: air or water. Mosquitoes can do it. Ticks or other insects, saliva, tears, or sweat that is not mixed with the blood of the person with HIV. Note that. Shaking hands, hugging, sharing toilets, sharing dishes, silverware or drinking glasses, or engaging in closed mouth or social kissing with an HIV person. All this means you can transfer HIV and AIDS. In this video, we are going to talk about sexually transmitted infections or STIs. First of all, what's an STI? STI used to be called STDs or sexually transmitted diseases. An STI is an infection that is caused by bacteria, virus, and parasites. Now, there are more than 30 transmissible diseases. When a person gets in contact with an infected person, they may also get an STI. Now, let's look at some common examples of STIs. We have gonorrhea, chlamydia, genital herpes, genital warts. We have syphilis, HIV, and Hep B, that's hepatitis B. Over 1 million people in the world acquire STIs each day. That's equal to the amount of people living in Cuba. How is STI transmitted? To answer this, you must first talk about where these germs live in the body. They could be found in open wounds such as in sores, bumps, in blood cements, and vaginal fluid. STIs can pass from one person to another through any kind of sexual activities and even through non-sexual activities. So when one engages through these activities, it could be transmitted. Am I at risk? Am I at risk of an STI? There are certain risk factors that make some person more likely to develop an STI than others. Having sex with someone without condom increases the chances of acquiring STI. Now, it's very important that we do some helpful tips that will help adults to protect themselves against STIs. You can receive hepatitis B vaccine, receive Hep B vaccines, and vaccines against birth control pills and IUDs are effective in preventing pregnancies, but they do not prevent you from STIs. It's important to ask your doctor to test you for STIs when you first become or decide to become sexually active, as well as being sexually active. It's a good idea to be tested every year or frequently if you are at the risk of having infections even if you are sexually active with only one person. So it could be transmitted through blood sample, could be tested through urine sample, blood sample, swabs, urethra, vagina, and so on. You can tell your partner or partners to have a test for STIs. So most times STIs are being managed with prescribed medications doctors prescribe for their patients, and as they go on with these medications, they become better. So you can always ask your doctor if you are at the risk of an STI. So it's very, very important that we avoid persons that are infected with STIs. Oftentimes you can't see it. Some persons don't even show symptoms, and you can see these diseases with your naked eyes. We just have to be very careful. Thank you for watching this video. See you around in the next class. Bye.